Hello, we are from small group discussion B2. Now we will present about our student project titled Hypertension Without Complication. These are our group members. My name is Sherly Septiana Chandra with real last digit of student number 129. Chapter 1, Introduction. Hypertension is a consistent elevated blood pressure in the systemic arteries. All socioeconomic and income levels have an associated prevalence of hypertension, and this prevalence increases with age. Hypertension is the primary avoidable risk factor for cardiovascular disease, kidney disease, and cognitive impairment. Hypertension also happens to be the leading cause of all-cause death and disability with an impact on the world population. The discipline of family medicine is dedicated to provide high-quality, evidence-based care. Family medicine is the practice of family physicians organizing, managing, and providing health services. It is a subcategory of primary care. Primary care refers to the provision of first contact, comprehensive, coordinated, and continuous health care to people without regard to gender, organ system, or condition. These are our problem formulation. These are our objectives to answer the problem formulation. These are the benefits of our paper, is to enhance the knowledge and understanding about family medicine, give general and specific information about hypertension without complication, and become a reference source for further study about hypertension without complication. That's all from me. The presentation will be continued by my friend. Thank you.
Hello, my name is Putu Damaghita Laverda Suri with last three-digit number is 036. So I would like to explain about the identification of examination. So basically, there are several procedures in identifying someone with hypertension with no complication, starting from anamnesis. Most patients with hypertension with no complication, or known as essential hypertension, have no symptoms. It is because usually detected during blood pressure screening, where if it is not treated immediately, it can increase the risk of serious disease, which can lead to death. That's why hypertension, usually known as silent killer disease. For some patients who have severe high blood pressure, usually they can experience several symptoms such as headache, dizzy, chest pain, blurred vision, breathing difficulty, and etc. That's why there are some questions that we need to ask to new patients that are suspected with hypertension. Those are personal history, for example, like risk factor, medical history, and also symptoms in detail, and also family history because hypertension are inherited disease. These two exclude from secondary hypertension. And then for patients who have been diagnosed with hypertension, we can ask several follow-up questions, such as how long the patient have suffered from hypertension, past medical history, past medicine history, and is there any side effect after consuming medicine? This to evaluate the health condition progress of the patient. That's all from me. Thank you.
Uh, Hello, my name is Stephanie with student last three digit 083. About the physical examination, hypertension diagnosis is done by accurate blood pressure measurement. That is done by no conversation, empty bladder, appropriate cuff size, and the cuff is placed on bare arm at heart level arm support, uncrossed legs, and support back and feet. Measurements will also be done 2 or more readings on separate occasions. Also, ambulatory measurement should be also done as comparison. Measurement is classified later into several categories as normal, elevated, stage 1, and stage 2 hypertension. Some additional examinations that are recommended are fasting blood glucose or HbA1c, complete blood count CBC, lipid profile, serum creatinine, estimated glomerular filtration rate, ECG, urinalysis, and THH. Some more optional examinations are echocardiogram, uric acid, urine albumin, and evaluate for prescribed and over-the-counter drugs consumed by the patient that may elevate the blood pressure, such as NSAID, etc. Perhaps that's all. Thank you.
Hello, my name is Sendi Aprilio with the last three digits of student number is 034. I'm going to explain about the risk factors of the disease. The cause of hypertension can be varied, including age, genetics, race, unhealthy lifestyles, electrolyte imbalance, obesity, smoking, and stress. First is age. The risk of hypertension increases with age. Older people tend to have stiffer blood vessels and more susceptible to hypertension. Second is genetics and heredity. Genetic factors and family history of hypertension can increase a risk of developing hypertension. Third is race and ethnicity. Some ethnic have a genetic predisposition to hypertension. Africans, Latin Americans, and certain Asians are at higher risk. Fourth is unhealthy lifestyle. Lifestyle factors such as eating diet in high salt habits, excessive alcohol consumption, and lack of physical activity can lead to increased blood pressure. Fifth is electrolyte imbalance. As a result of high salt intake, there is an electrolyte imbalance in the body, especially sodium and potassium, which can affect blood pressure. Sixth is obesity. Being overweight or obese can increase blood volume and require higher blood pressure to pump blood throughout the body. Next is smoking. The chemicals in cigarette can damage blood vessel walls and cause narrowing arteries that can increase blood pressure. Last is stress. Prolonged stress or higher levels of stress can affect blood pressure. These factors influence each other. Management of the risk often involves a combination of lifestyle changes, weight control, regular exercise, and pharmacological treatment. The National Health Insurance Program in Indonesia can provide financial protection in terms of health service because this program covers various types of disease, including hypertension. This program usually includes basic examination and treatment for hypertension, such as consult, blood pressure measurement, and medications prescription. Therefore, if you are at risk of hypertension or concerned about your health, consult the professionals for appropriate treatment. That is all from me. Thank you. Next.
Hello, doctor. My name is Yudhistira with real last digit student ID number 098, and I will continue the presentation about identification of family interaction. So in this slide, the similarity of genetics, characteristic, behavior, lifestyle, etc. have a significant role to someone's health status, especially in this case, the risk to get hypertension. There are many factors that contribute to hypertension, and sleep behavior is one of it. For example, if there is a family member that plays music loudly, the other family member can be hard to sleep, and the same will be happen if there is a children who still can't go sleep alone and shares a bed with their snoring parent. They also will get sleep difficulties, and it will affect their sleep quality. Number two is about family diet. Food like junk food, salty food, fried food, etc., is a kind of food that can raise our blood pressure, and we can't deny that junk food can be a family routine if there is no one at home who have time to cook. For example, if there's a wife that also go for a job. The number three is about physical activity. Moderate physical activity for around 150 minutes per week are very recommended, not just for adults, but also for the children. And children need a good role model for this kind of things. And parents who have time for their family and, of course, physically active can encourage their children to do sport or just go for a jogs, I think.
Hello, my name is Putu Sherly Pratiwi, which is the number of 221. I would like to continue the presentations about the identifications of the disease impact to the family. Hypertension, a prevalent concern in family medicine, extends its influence beyond individual health, significantly affecting familial dynamics. The management demands of hypertension, from regular medical checkups to potential lifestyle changes, can create financial strain, disrupting the family's overall well-being. The impact extends to the overall quality of family life. Activities and social engagements may be modified to accommodate the needs of the family member managing hypertension. Not only medical supports are needed, but also family environment that fosters understanding, empathy, and open communication.
Hello everyone, my name is Stevanus and Surya with last three student numbers. Hello everyone, my name is Stevanus and Surya with last three student number is 5 nil. So now I will explain about the identification of family medicine approach. The first one is holistic care approach. Holistic care approach involves addressing the multidisciplinary aspects of an individual's well-being to effectively manage blood pressure. Beyond traditional interventions such as medication monitoring, this approach may include dietary modification, exercise, stress reduction, and encouraging a sportive environment. Secondly, continuing care approach. Continuing care approach for hypertension involves a sustained strategy to address the long-term needs. This model focuses on ongoing support and monitoring to effectively control blood pressure and reduce associated risks. Continuing care for hypertension covers regular medical checkups, medication adherence, lifestyle modifications, and patient education. That's all from me.
Hello, my name is Steffi Ayu Soejanto with Relay Student number 163. So I'll be explaining about the comprehensive approach. This to mitigate associated risks and improve cardiovascular health through cholesterol control, blood pressure reduction, and lifestyle changes. Adequately researched lifestyle interventions have been identified for the prevention and management of hypertension. These interventions include weight loss, increasing physical activity, and adhering to a nutritious diet. That's all from me. Thank you.
So next is primary prevention of hypertension. The prevention is by changing the lifestyle, such as salt restriction, low intake of saturated fat, high intake of vegetable and fruits and fish, regular physical exercise, and low intake of alcohol, and quit smoking. The diet is then packed up into the DASH diet. What is recommended from DASH diets are the first one, carbohydrates are composed of cellulose and healthy starch to supply micronutrients. Then fruits with low glycemic index, whole grain and green leaf vegetable. The fat that is recommended is N3 polyunsaturated fatty acid, or usually it's called PUFA, where it can lower LDL or low dense lipoprotein, increase HDL or high dense lipoprotein, and regulate inflammatory response. And next one is processed meat can cause hypertension and has carcinogenic substance, so it is not recommended for the diet. And then quitting smoking, also widening blood vessels, thus lowering blood pressure.
Hello everyone, my name is Putu Daiva with the last 3-digit number 103. I'm going to continue our presentation about secondary prevention and tertiary prevention of hypertension. We'll start with secondary prevention, which includes the efforts to detect early manifestation of a medical condition and prevent them from progressing into more severe state. In the case of hypertension, this means returning blood pressure to normal level before clinical symptoms appear. So you have to control the blood pressure before there is any symptom. The first step is diagnosis, in which hypertension can be diagnosed with 2 to 3 office or home blood pressure measurement, with interval of 1 to 4 weeks with each visit, or with just one measurement if blood pressure is more than 180 over 110 millimeter Hg. The cutoff point for home blood pressure measurement is over 135 over 85. The intervention for secondary hypertension prevention includes lifestyle modification, which was already explained in primary prevention, and pharmacotherapy, which can include ACE inhibitors, angiotensin receptor blockers, calcium channels inhibitor, beta blockers, and TSA diuretics. For tertiary prevention, it includes efforts to limit the morbidity and mortality of an ongoing disease by various approaches and interventions. In the case of hypertension, this means controlling blood pressure to reduce the further risk of morbidity and mortality from hypertension-related disease, which includes coronary artery disease, cerebral vascular disease such as stroke, peripheral artery disease, and heart failure. Just like secondary prevention, the first step of this prevention is diagnosis of the disease, and then interventions to control blood pressures via lifestyle modification and pharmacology treatment. That's all from me. Thank you.
Good afternoon, Dr. and friends. My name is Rizky Purba, and my last 3-digit student ID number is 158. Chapter 3, the conclusion. Hypertension is a condition in which the blood pressure is higher than normal. Hypertension can be caused by a variety of reasons, including genetic, unhealthy lifestyle habits such as high salt diet, a lack of physical activity, being overweight, and excessive alcohol consumption. In family medicine, hypertension is a common concern that has a substantial impact on family dynamic in addition to individual health. There are various types of approach family medicine for hypertension without complication, such as holistic care, continuing care, comprehensive care, personal care, preventive approach, and collaborative approach. And that's bring us to the end, and we would like to thank you for your attention and your time. Thank you.